And good morning. It is time for our regular lunch and learn. And so what I want to do today is talk to you about MTHFR. And so I put up my sneak peek post like I always do. And my son-in-law said it sounds like I'm saying a swear word. And so that made him interested because he knows I don't swear. And my niece said the same thing. And so no, I'm not swearing, but the scientists do I can't remember the word right now, but anyway, they put just the letters up because the word is so stinking hard to say. And so when we get to down in there in that report, then you're going to laugh and you're going to be, oh, well, that's why they call it MTHFR. Now, I'm going to get a little bit geeky on you today because we're going to be talking about genes. We're going to be talking about gene SNPs and what gene SNPs mean. Now, MTHFR is an acronym. There's a word right there. For a methylation pathway issue. Now, get your cameras ready because I'm going to show you. This piece of paper right here. All right, this is the methylation pathway, and every one of these things in a box is a gene. Okay, and so I'm going to wait just a minute to make sure that you can get a screenshot. All right. So if you need me to hold it up here a little bit later, then I'll do that again. But each one of these rectangular boxes is a gene. Now, we do not live in the Garden of Eden. So because, time, misfolding of proteins, all that kind of stuff, when we inherit our DNA from our parents, we get chromosomes from our mom and we get chromosomes from our dad. In a perfect world, when they came together, the chromosomes would be perfect. And so what that looks like in a DNA report is everything is green. Now I'm going to show you mine. I'm not worried about you knowing my health history and all that kind of stuff, but this is a major report. These are all the different herbs and supplements that I need because of all the gene defects that I have. So we're going to be talking about this page because this is the methylation pathway. And you can see I am not all green here. All right, I've got quite a few orange and I've got some pink ones. Now, what that means is one of my parents gave me a whole set of chromosomes that did not have any gene defects. One of my parents gave me one of those genes that was defective. So the green means that there's no clinical abnormality. The orange means that one set of chromosomes had a problem with that particular gene. And then when it's pink, that means both parents had a problem with that gene. So when we're looking at our genes and we're doing this report, and this is an easy report. We do this right here in the clinic. Ta-da! It comes in a box like this. Inside the box is a mailer, prepaid mailer. You take a swab. It comes in the box. You swab the inside of your cheek for a minute. Then you swab the other side of your cheek for a minute. And you can send that off to the lab. The lab is a private lab in Austin, Texas. The DNA results go nowhere else. It doesn't go to the government. It doesn't go to your doctor. It doesn't go anywhere. It goes to me and to you, and it stays at the lab. So there's no problem of people getting your DNA that we don't want to have your DNA, right? Because we don't want anybody having that. So I've done this 3 times. I've done the big report, 55 different genes. I have done the essential vitamin report, and I have also done the diabetes prediction report. I am very close to the green, which means I have very, very low chance of getting diabetes. Of course, I eat well and all that kind of stuff. I exercise. I do keep my weight down. All those kind of things that I have control over. There's nobody in my family that I personally know, parents, grandparents, or great-grandparents that had diabetes. Mind you, my great-grandparents died when my grandparents were infants, so who knows, right? But what we do know, nobody that we know has it, and so I'm not intending to get it. But those are some of the other reports. You can get a DNA report on, let's see, if you have an autoimmune disease, you have a lot of pain, you have to take a lot of prescriptions, and prescriptions are not working. We can do a DNA report on pharmacology, what drugs will work for you, what drugs are the best drugs for you, and that kind of thing. We've got it for ADD, ADHD. We've got it for female issues, male issues, geriatric issues, all the things. And it's all about where your genes are not perfect. Now, on this particular one, as I said, this one is mine. There's about 14 pages in this report. And you can see on every page, I have issues, right? It's not all green. That's probably the best page. And that is the, what is this testing for? Oh, this is just testing for my gene integrity. So this is a pretty good one, you know, no pink ones. We don't want pink ones. We're all going to have pink ones, guys, so it's not a big deal. You just have to take the right kind of supplementation so that you bridge that gap. Now, my husband did the same thing that I, excuse me. And he said, well, if I take all these supplements, will that make the genes well again? And I said, no, your DNA is what you are born with. It is how you came into this world. It is how you will go out of this world. But there are supplements that you can take to bridge that gap. So we're going to be talking about that today, and we're going to be talking specifically about the methylation pathway, which is what I showed you on that photo. So I'm going to tell you a little story about Allison. Allison took her 9-year-old son to his doctor several years ago. She followed her doctor's advice by giving him folic acid because he had been diagnosed with celiac disease. Now, celiac disease is a disease where you are not able to process wheat. Now, you may be gluten intolerant. In fact, most of us are gluten intolerant because here in the United States, they spray the wheat crops, all of the grains. They spray them with Roundup twice before they're harvested. And so all of the grains that we have here in the United States from industrial farming are covered in glyphosate, which is a heavy metal. That is not to the extent of celiac disease. When someone has celiac disease and they eat wheat, whether it's organic wheat or processed wheat, whatever, they are in real bad trouble with their gut. And so we know people that are like that, and we don't want them to have any kind of grains of any kind because it messes them up. Well, she gave him folic acid, which is the synthetic form of a B vitamin. She did not know that her son had MTHFR issues and could not process synthetic vitamins. So most of the vitamins that you're going to get in the grocery store or the big box store are going to be synthetic. Why? Because it's a lot cheaper to make them than to get them from your foods, your fruits and vegetables, which is the way that God wanted us to get them. However, she gave him these synthetic vitamins, and she did not realize that the folic acid was triggering her son's erratic, hyperactive behavior. After investigating, she learned that some patients, especially those with certain genetic variations, tend to react negatively to folic acid supplements and fortified foods. Now, when we're at the grocery store and we see something that says fortified with A, B, D, K, whatever, we think, oh, it's got more nutritional value. But you have to remember that fortification is all synthetic, and you might not be able to process that. So her son developed darting eye movements and difficulty in focus. He was also impulsive and unable to sit still. Now, does that sound like anybody you know? Well, it sounds like a lot of people I know. It sounds like a lot of people who bring their children in to see me. And are they diagnosed with celiac disease? No, they are not. They're diagnosed with ADD and ADHD. But a lot of times it's parasites, it's gene defects, it is not digesting their food, all right? And so we have to look at all these difficulties. So Miss Allison, eliminated these triggers from her son's diet and supplements. And then after several weeks, she reintroduced them. She again observed pronounced changes in her son's behavior. When he was in his late teenage years, he and his twins were both diagnosed as having an MTHFR gene mutation. Now, MTHFR stands for methylene tetrahydrofolate reductase. All right, that's a big, long word, so you guys be glad we call it MTHFR. It is both an enzyme and a gene. The MTHFR gene mutation impairs how the body will process folate and other vital B vitamins. Now, Here in holistic world, we call your B vitamins the don't go crazy vitamins. We all need B vitamins. B vitamins are water soluble, which means you don't store them, which means you need to have a supply of them every day, and you get them from your fruits and vegetables. And so when children come in and they don't eat any fruits and vegetables, like I had a child come in this week, hyperactive, very hyperactive, and he eats toast, chicken nuggets, and milk, and that is it. Absolutely no fruits, absolutely no vegetables. And I tried to encourage the mom to make some changes, and she was pretty, he won't eat it. He just won't eat it. And so I just don't know what I'm going to do. And so I feel very sorry for this child because, you know, he's not getting the nutrition that he needs, which is going to cause even further behavioral issues as he gets older. Now, he could have MTHFR issues, which we could address, but you're still going to have to take supplements. He didn't want to take supplements. Mom didn't want to make him take supplements. So, you know, it's one of those things. If you're not going to change, then things are not going to change. So this MTHFR makes you where you're not very able to process your B vitamins. Now, your body needs these B vitamins, folate in particular, to break down homocysteine, which is an amino acid that is an inflammatory marker linked to heart disease and other conditions. With an MTHFR mutation, the body may not process folate well, leading to an increased level of homocysteine. So healthy, intact MTHFR genes and bioavailable folate help regulate the homocysteine levels. Now, when we're looking at homocysteine on your blood work, and if you have comprehensive blood work, that will be there. I think the value we want it to be is under 5. Most of the time, people come in with it above 5. So what does that tell us? That tells us that most people have gene dysfunctions. Now, when we think of a gene dysfunction, we think it's going to show up physically. It's going to show up in the way we look. It's going to show up in the way our brain works. It's going to be something that's visible. But you saw my report, and I have a lot of genes that are broken. I call them broken. I have a lot of genes that are broken, but if you didn't know that, you would not know that. Now, I don't want to have these kind of sassy remarks from people that know me very well, all right, because my gene defects are not up for discussion, all right? Folate is also important to repair your DNA. So if you have MTHFR defects, you're not able to repair your DNA. As we get older, the proteins in the DNA, that's what our DNA is proteins. Those proteins fold and then misfold, and then when the gene is making copies of itself, it makes a variant, and that variant can have all kinds of issues. And so we don't want to have those kind of things, and so we want to do whatever we need to do to bypass or to bridge that broken gene. So that's what we're going to be talking about today. So as I've told you, we've got 2 MTHFR genes from both sides of the family. Now, there's actually more than 2, all right? The 2 most common, and you can write this down, is C, the letter C, 677T, and the letter A, 1298C. So on my sheet, this is me, upside down me. On the C677, I've got 1 gene that's broken. On the other one, I've got no gene that's broken. All of these genes have to do with methylation. So they're all on that methylation pathway, and even these genes as well, right? So I've got a mix of green, orange, and pink. Most of mine are broken. Most of mine are in the orange. And what that means is I need to have specific supplements to bridge that gap, especially as I'm getting older, so that I do not have problems because my body cannot repair the DNA because I have some broken genes, okay? That's the takeaway that I want you to have today. Even if you have broken genes, if you take the right kind of supplements, you can bridge that, and so you're not going to have any problems, all right? When you have intact MTHFR genes, you're able to repair the DNA. You're also able to detoxify the body the way you need to, so you have a cleaner cellular body which means you don't have parasites or fungus or heavy metal or chemicals or viruses or anything like that. So when you have one gene that's broken, the orange one on my particular test, then that is called a heterogeneous mutation, or a mutation of only one gene. When you've got the pink brokenness, that's when both parents had a break there, those are called homogeneous mutations. Okay, so homogeneous mutation is a more serious mutation. In the United States, 20 to 40% of white and Hispanic people are heterogeneous for the C677T, according to a 2015 article in Circulation. This particular mutation is very much less common in black people, affecting only 1 to 2%. Now, why is this? Nobody knows. It's all in the genes. And so we don't want to be part of the 20 to 40%, but if we are, I'm going to tell you how we cope with that. MTHFR is linked with an increased risk of several conditions. So this gene mutation has been linked to ischemic stroke. All right, we know what that is. It cuts off blood supply to the brain, according to research. Researchers performed a cross-sectional study on 67 patients with acute cardioembolic stroke stemming from a blood clot in the brain, and found that patients with the MTHFR variation are more likely to have cardioembolic stroke. So what does that mean? Does that mean if you have a break in your gene, like me, I have breaks in my gene, does that mean I'm destined to have a stroke? No, it doesn't mean that, especially if I take methylfolate, which is the supplement that I need to bridge that gap. My homocysteine is going to be low, my DNA is going to repair, my body's going to clear, all those kind of things, because I take the right form of a B vitamin. So, published in Brain Science in 2020, the study shows that patients with the MTHFR defect also experienced elevated systolic blood pressure and higher cholesterol. While systolic blood pressure is that bottom number. Remember, they want your blood pressure to be 120/80. Well, that 80, if it goes up to 90, 95, 100, 110, whatever it goes up to, that's elevated. And they found that people with elevated systolic pressure most often had MTHFR issues. So that's important if that's you and you've got blood pressure issues. If you just took a methylfolate B vitamin, you may solve all of your problems. In a study in 2021, it was found, published in Genes, it found that the C677T mutation was tied to breast cancer in white and Asian women. So I'm looking at mine. And that C677T, that is a orange one. So that means one of those genes is broken there. So that means that I need to be really careful and monitor things. And that's why we do thermography and all that kind of thing, because we want to make sure that everything is good. In a 2022 systemic review and meta-analysis in disease markers shows that some MTHFR gene defects are associated with an increased risk in autoimmune disease. Now, why is that? That's because the body cannot clear the toxins, right? We read that earlier. It cannot clear the toxins, so the body is always fighting those toxins. And an autoimmune disease is when your immune system becomes so confused because it's dealing with so many things that it forgets what is self and what is other. And so, like, my thyroid is self. If I had Hashimoto's disease, then my body would be thinking that my thyroid was other, it didn't belong to me, and it would start attacking that. And so we want to make sure that we have good bridging on that DNA so we're not having to work with autoimmune issues. Specifically, the MTHFR C677 was a risk factor for Beck's disease, which is a disease of inflammation and swelling in the blood vessels, and multiple sclerosis. Additionally, 1298A was a risk factor for multiple sclerosis. Happy to say that that particular gene is 100% intact, so I don't have to really worry about that in my gene makeup, which is a good thing because I have enough other things that I need to be concerned about, okay? Autism is a diverse group of conditions affecting communication and behavior, usually appearing by age 2. In a 2020 review and meta-analysis in Research in Autism Spectrum Disorders, they found a significant association between the C677T and the A1298 MTHFR gene varieties and an increased risk of autism disorder. The MTHFR gene mutations can affect the methylation process, such as neurotransmitter synthesis. All altered neurotransmitter levels can potentially influence brain function and development. So what else it does, if that is altering your neurotransmitters and that kind of thing, remember, all of the vaccinations have aluminum in them. They used to have mercury in them. I understand that most of the mercury has been removed. However, there are nanodoses of aluminum that are so small that they are able to cross the blood-brain barrier. The problem is with people that have MTHFR mutations is they're not able to clear that. And so that's why they have trouble, and that's why they're linking this mutation with autism. In a 2021 case report in the International Journal of Scientific Research and Management, it showcases successful alternative treatments for a 32-year-old man diagnosed with major depressive disorder who had been on psychiatric treatment for 2 years and 8 months. Instead of continuing with an antidepressant, the doctor administered 15 milligrams of L-methylfolate in the form of vitamin B9. After a 4-month follow-up, the patient reported complete relief from depressive symptoms. So this is important. Remember, I told you at the beginning of this report that the B vitamins are the don't go crazy vitamins, right? They're the ones that keep you sane. They're the ones that keep your brain working. They're the ones that keep your endocrine system doing what it needs to do, anything that makes a hormone. And so if you are not able to process that because you have the MTHFR issues, then that is important information for you to know. If you have a child that is hyperactive, ADD, ADHD, and you don't want to put them on medicine, which that would be my perspective here, you can come into the clinic and we can do this little test. We'll send it off to Austin. They'll send you your report, and it's important information that we need to have. In a 2012 study, found that patients were given 15 milligrams of L-methylfolate a day. As many as 92% achieved remission of symptoms within the first 6 months of therapy. Now, I went to this report. I looked at this report on PubMed, and it was all talking about people who were on SSRIs for major depressive disorder. So they found that 92% of people, if they took methylated folate for 6 months, they had absolutely no symptoms. So that is huge, because who wants your loved one to be depressed? Who wants your loved one to be on medication all the time? And so this is something that is a very easy thing to do. Methylfolate is available everywhere, and it's not expensive. It's just not expensive. The methylated B vitamins have reduced anxiety, so we have been able to reduce our dose of SSRI for anxiety and depression, and sleep is improved. So this is really, really important. We all know people who have anxiety disorder. We all know people who are depressed. We all know people who are insomniacs. Maybe it's a gene issue. So as MTHFR gains more attention, both patients and medical experts are seeking answers. Now, I've known about MTHFR for a long time. Don't ask me how I knew about it. I guess I picked it up somewhere in my reading, somewhere in my studies. When my mother was diagnosed with cancer, I asked the doctor to run a test to see if she had the MTHFR issue. The doctor looked at my mother and said, I have no idea what she's talking about. So this was as recent as 2016. So this is not something that is absolutely mainstream, but it should be. When you look at all the people that are affected with autism, when you look at all the people that are affected with ADHD, when you look at all the people that are affected with neurodegenerative disease, multiple sclerosis, Alzheimer's, all that kind of stuff, then looking at the gene defect and how we can better manage their nutrition is a real big deal. So several factors in the environment contribute to MTHFR defects, including exposure to heavy metals, glyphosate, and microbe loss. Now, we've talked a whole lot. We had several programs where we're talking about the microbiome in the gut and how if we don't have the right probiotics, if we don't have the right flora in there, then we're not going to be able to do what we need to do in order to keep our bodies healthy. So this is what a cardiologist, Dr. William Davis, says about the microbiome. He's a microbiome researcher. And he says that the damaged food that we are eating are causing gene defects to be passed on to our children. In a mathematical analysis published in the World Cancer Research Journal in 2021, researchers conducted hair and mineral testing and DNA swabs of 319 patients. They discovered a connection between certain gene defects, including MTHFR, and elevated levels of heavy metals such as lead, aluminum, and mercury. So this is important because when you go to the big box store and you know you need a vitamin and so you buy one of those all-in-one vitamins, don't do that. Number one, they're all synthetic, and number two, they don't have the methylated form of the B vitamin, so they're not going to do you any good. We have to understand that there is a difference between the synthetic B vitamins and methylfolate, which is the bioavailable form of folate. Fortified foods and supplements that contain folic acid are synthetic forms of folate. Folic acid is fine for people that do not have an MTHFR mutation. However, those of us that do, and even though of those two genes, one is a heterozygous, that means I have one parent that had a problem. The other gene I'm okay in, but still, that one problem that I have, plus there's those other genes that I showed you. I think I had 2 pink ones, maybe 3 pink ones. What that means is that my methylation, which is, where's my little cheat sheet here? Get your cameras ready. Let me show you this again. My methylation is off by 35% because of the gene defects that I was born with. So if I take methylated B12, if I take methylfolate, then I'm going to be able to bridge that gap, and it's not going to be a problem with me, okay? So pregnant women often have their prenatal vitamins have folic acid. So if you are pregnant and you have folic acid and you have the MTHFR variations, then you're not going to be able to get those essential B vitamins, and that's not going to be great for your baby. So please, you can come here and we can do the DNA testing, or you can just go to your doctor and do a blood test for the MTHFR. I don't know anybody that's done that, but the report says that you can do that, and so you want to do that. You also want to look in your health food stores for a methyl B12, a methylfolate supplement, so you're able to bridge that. Now, you can also get this in your foods, and so you can get it in your leafy greens, so your collard greens, your dandelion greens, all of that, your broccoli greens, carrot greens, all that kind of stuff. You can get it in that. You can get it in your avocados. You can get it in your asparagus and in your legumes. So that would be lentils and all that kind of stuff. So there's a lot of ways that you can get it in your food if your food is organic, if your food has enough vitamins itself, the fertilizer and all that kind of stuff, if it's not synthetic stuff, if it's the good stuff, because that fertilizer is what the plant absorbs to make the food that we eat. If the nutrients are not found in the soil, then they're not going to be found in the food. That's why I do the Pharmanex vitamins, and so I didn't bring my scanner up today, but you've seen me with my scanner before. The scanner will, on the heel of your hand right here, there's a laser that will measure how much of the fruits and vegetables that you intake are you actually absorbing. As you intake your fruits and vegetables, your body takes those carotenoids from the food, turns it into antioxidants. The antioxidants go against the free radicals. We all have free radicals. So free radical damage is resting on the inside of your body. Also, the antioxidants help you with aging. It pushes back aging. So this is why I take the vitamins that I take, because they're absolutely absorbable. They are in the ratio that the body needs. They are formulated in a way that an older person is going to be able to absorb them, because as you get older, your absorption ability decreases, as almost everything else does with age, right? That's because the proteins start misfolding and that kind of thing. And so if you take vitamins that are able to do what they need to do, then you're going to stop that process. If you've got the MTHFR gene variation, you take methylfolate, methyl something bicolamine, something like that. I need to look at it in order to read it, too many letters. But those kind of things are able to help you bridge the gap. So even if you have these gene defects, it's not going to ruin your life. So this is knowledge for you. Knowledge is power. You can change the way you supplement. You can change what you're doing. You can change what you're doing with your children. And then you can bridge that gene gap. Remember, 20 to 40% of white people have these mutations. If you've got darker skin, you're just a little bit, blessed on that. And so you don't have to worry about that so much. We need to take care of that. And like I said, 20 to 40% of us have at least one of those mutations. So let me know if you have questions. Thank you for always liking, sharing, commenting, all those kind of things, because that blesses us and we're able to help more people as more people get the word. Remember, you want your methylfolate, not your folic acid. So it is the weekend. Thank you for joining me. Thank you for doing all the things that you do. And we will see you next week. Take care.